everyone. I hope you're enjoying your snow day. I just want to go over some of the information that we're going to be talking about in class. But as a reminder, this information comes from chapter 2 in your textbook, so you're going to want to make sure that you read it in depth since we won't be together to talk about this. When we get together on Thursday in class, we are going to continue with the mini presentations. So again, please be sure you're working with your groups to be ready to present. I'm going to go over some of the stuff that might be helpful in your presentations as well as just for this class. So we're going to be talking this week about public health organizations. So thinking about the people that are creating programs, policies, and ways forward to improve our public health, or hopefully improve our public health. And so when we think about this, we also have to think about what might be stopping an organization or a community from being able to address the public health concerns that are present. It's only been about the last 100 years that we've been consistently thinking about addressing this. And so there's been a lot of trial error in this time. And we've also started thinking about these organizations in a way of classifying them. And so we're going to talk about a few different examples from these categories. So in governmental, we can take governmental large scale on a global, but then we can also narrow down and zone in on local governmental public health agencies. When we talk about things that fall within the governmental realm, these agencies are part of the government structure and typically funded through tax dollars. Usually these governmental agencies are going to be managed by officials within the government that have authority over specific geographical areas or different issues related to the geography. So again, just either really large scale or small scale. A quasi-governmental agency is going to receive some government funding, but also has voluntary operating control independent of the government within that it's housed within. Typically, quasi-governmental, again, receive some funding, but also have really large fundraising abilities that's getting money from more private sectors. So things like the Red Cross, United Way, National Institute of Aging are some ones that you may have heard of before. We can also have non-governmental agencies. These are going to be funded through private donations or membership dues. And usually non-governmental pop up whenever there's some sort of health need that is unmet and people take action to meet that need. There's really no governmental control involved other than just making sure these individuals, groups are meeting whatever tax requirements depending on their tax status. And there's tons of different organizations that we'll discuss later on that fall within this category. And so looking at those governmental agencies from a really large perspective, the World Health Organization, or WHO, is one of the largest global health agencies. It has 6 regional offices with headquarters in Geneva, Switzerland, so all over the world there's representation. It was started in 1945 by a charter of the UN. And basically this charter called for the need to establish a health agency for anybody within its membership. And so through time, we can see how the World Health Organization became stronger and grew, representing lots of people with no specific country owning the WHO, and it operates throughout the world, creating many, many, many health policies and directives aimed at global health. It is, again, a global international governmental agency with members joining. There is somewhere around 194, and potentially right now 193 member states. And the work is financed by the member nations. And when they look at how members are going to pay membership dues, it's based off of the GDP of the country. So smaller countries with lower GDPs are paying less than larger countries. The current director is from Ethiopia. And the mission of the WHO or WHO is attaining the highest possible level of health for all the people. And that's regardless of whether or not you're a member country. There is this triple billion target that was a strategic priority set for 2019 to 2023. I have a link here to the dashboard. And if you do go here, you'll see that while it was through 2023, the work is still ongoing because of the COVID pandemic. Their idea of stopping by 2023, the goals have not been met. So they're still working towards this. But really, the dashboard is helpful in looking at the breakdown of how different member countries are making progress towards meeting the goals of helping 1 billion more people benefit from universal health care coverage, more people protected against emergencies, and enjoying better health and well-being. So I recommend that you check that out. Some of the most notable work from the WHO is helping to eradicate the smallpox uh, issues that were going around in the world by creating a vaccine and distributing it in 1979. The first written account of smallpox comes out of China and Egypt over 3,000 years ago. So over 3,000 years ago to 1979, smallpox was a major problem across the world, and the WHO was really helpful in eradicating it. I am going to put a link to the movie about this, so Who at 70, and you'll get to see that a little bit later. And so this work is guided by the 13th General Program of Work and the Millennium Declaration, which sets goals to work towards that triple billion target, as well as others, goals that they have established as needing to be met. And with lots of focus initially on a few years ago on COVID-19, there's a lot of focus on refugee health in conflict areas, and we can go on and on about conflict areas right now. One of the sort of important things about the WHO in the United States is that on January 25th, 2025, so just over a year ago, President Trump decided to leave the WHO. And as of this recording this week, the final steps are being taken to fully leave the WHO. So we will no longer be a member nation. Bringing some of the governmental levels down a little bit smaller, thinking about the United States as a whole, our National Health Agency is the Department of Health and Human Services, or HHS. This is a U.S. governmental agency, and each nation across the world typically has their own department or agency responsible for protecting the health and welfare of its citizens. This is headed by the Secretary of the Health and Human Services, which is currently RFK. You're probably pretty familiar with him. He's in the news a lot. And this person is appointed by the president. The annual budget for the U.S. government right now is just under $95 billion, whereas in years past it was over $1.3 trillion. This pretty significant decrease in funding was achieved recently by slashing the budget for the CDC, for Centers of Disease Control, by 54%, and the NIH, which funds a lot of research, by 20%. The HHS is focused on improving healthcare across and health status across the United States. Typically, this focuses on different policies and procedures, educational materials, as well as funding research to improve our health. The focus of the HHS has been slightly different in more recent months, and so it's something that continues to evolve and change as we move throughout this current administration. This is a list of departments that are linked to the Health and Human Services that you guys will be talking about on Thursday. And so I'm not going to talk about these because you will be. So let's move on and think about state agencies. So each state is going to have their own more local Department of Health. This is still governmental. It's usually headed by a medical director who is appointed by the governor of the state. So similar to at the national level, these positions have turnover every 4 or so years. I have a link here to the PA Department of Health. If you're interested, you can go on and look a little bit into a little bit more about that. And just in general, state agencies play many different roles in improving or maintaining the health of the individuals within that state. And they do this by um, addressing all the different things on this wheel here. So things like establishing health regulations, providing a link between the federal government and the HHS and the local health agencies. They're going to be a really big communicator. They serve as ways for federal funding to leave the federal sector and make its way to people locally. And the state agencies are very important for maintaining lab services that local health departments can utilize. So, an example of this might be if somebody in a more local and often rural area comes into contact with something like rabies, your local health department is typically not going to have lab services that can accurately and quickly test for rabies. And so the state agency is going to have those labs to be able to get an accurate diagnosis and ability to get that under control. And then still governmental, but on the smallest scale is going to be our local health departments. And these are going to be within different municipalities, cities, counties. So it just is really going to depend on the size of the population and how rural or urban the area is. States do mandate that services are provided on a local level. And these are things that oftentimes we don't really think about. And so if you think about inspections of restaurants, that doesn't necessarily always come to mind when you think about public health or health in general. But being able to feel safe to go to a local restaurant and not leave with some GI disorder is a really big blessing. And so that falls on the local health department. There's just under 3,000 in the United States. Another area that also falls under this governmental health agency category is going to be public schools. So public schools receive funding from state and tax dollars, and they're providing health-related services that impact the health of the communities in which they're in by connecting uh, health with academic achievements and making sure that the children within a population are receiving the care that they need. Moving out of the governmental into the quasi-governmental, some health officials, or they're going to have some official health responsibilities, but oftentimes these individuals, like I said earlier, have a more voluntary basis. And so there's going to have very little, if any, government supervision or oversight, even though they may get some funding from the government and or work from the government. And so, like I said before, the Red Cross is an example of this. So there's official duties that are more government related, like providing relief after natural disasters to the individuals that are impacted by them, and then also uh, being the liaison between our military members and their families, especially at times of war or during emergencies. And so they've been called by the government to use funding that's provided by the government for those relief efforts. But then on the non-governmental side of things, there's things like blood drives, which I'm sure you're familiar with, volunteer services, all sorts of international services, funding research for a variety of different health outcomes, doing things like CPR and lifeguard training, all really important. And then they also have a large international movement. So not just thinking about the United States. And then non-governmental health agencies, like I said earlier, have some sort of private donation membership funding that is not coming from the government or tax dollars. They're operating without governmental interference, and there's many types that fall within this. And so a voluntary non-governmental health agency typically is funded by heavy fundraising. And citizens create this when some sort of need is not met by their local, state, national government health agency. These exist at all levels, so large scale down to small, with the big national groups focusing more on research, and local groups are typically carrying out the programs at the local level. And so something like the American Cancer Society or the American Heart Association falls within this voluntary group. A professional non-governmental health agency usually has some sort of lobbying power, so they're using the money that they fundraise to drive policy change. Health professions typically have some sort of licensing, certification, and other um, thing that is associated with this type of professional agency with the mission to promote improved professional practice. There's funding through membership dues. So for those of you that are also majoring in a healthcare discipline, you are probably familiar with what your professional association is. So for example, as a physical therapist, mine's the American Physical Therapy Association, and that would fall within this category. We can also have many other types like philanthropic. These are going to be endowed institutions where people are donating money, and can be large or small sums of money for the good of humankind. These foundations typically fund a lot of research and or programs. And so oftentimes you'll hear about maybe a wealthy individual that has decided to donate a lot of their money towards a specific things, and typically it's in a philanthropic foundation. We can kind of think of social, religious, and service related agencies pretty similarly, in that oftentimes these may not have an outright health focus or mission on the surface, but they do make contributions to improving public health. Things like maybe Lions Club, Kiwanis, Elks, Fraternal Order of the Peace, or Shriners. They might donate space or volunteer for events. If you think about, you might be familiar with Lions Club. They collect and donate gently used medical equipment, versus Shriners raises money for children's hospitals. And on the corporate level, the corporate level is really thinking about employers and how they contribute in a non-linear way. And so the corporate world employs a lot of people who provide healthcare benefits and typically some sort of health promotion programming. Maybe they offer gym memberships or other wellness programs that can reach a large number of people and are non-governmental in nature. That is sort of a brief overview of the different types of organizations. Again, we're going to come together on Thursday to talk about our mini presentations. And be sure to check the rest of this Facebook. Be sure to check the rest of this Canvas page, so that you know what you need to do to get credit for class on Tuesday, January 27th.